The MANIFEST study is a very important and large study that's been ongoing for a number of years now with numerous presentations already, and so at EHA again we're going to see some updates. So it studies the BET inhibitor from Morphosis, previously Constellation, called Pelabresib in patients with myelofibrosis as well as now with ET. So the study actually has 4 cohorts. So just to give you a very high level overview, Arm 1 is just Pelabresib monotherapy in patients who are no longer on a JAK inhibitor or who are ineligible for a JAK inhibitor. And that cohort is actually not being updated this year. So I'll move on to the other cohorts. Arm 2 is where you add Pelabresib to a stable dose of Ruxolitinib in patients who are having a suboptimal response to Ruxolitinib. So there we are seeing spleen response rates of 17% and symptom response rates of 38% and a transfusion dependence to independence conversion of 36.8%. So pretty encouraging results in this add-on setting. Arm 3 is where I guess the most excitement is, where patients are treated with the combination of Ruxolitinib and Pelabresib from the outset. So these are JAK inhibitor naive patients who receive both drugs in combination from the get-go. Here, the spleen response rate is 68% and the symptom response rate is 56%. So really very impressive figures compared to what you would expect with Ruxolitinib alone, suggesting that there is a synergism here, which has been shown in the lab and likely what we are seeing in patients. Also, there is anemia benefit, about 24% of patients having an anemia benefit in the Arm 3 or the treatment naive cohort. And I'll mention importantly, both in Arm 2 and Arm 3, there is bone marrow fibrosis reduction. As early as 24 weeks, we are seeing at least a 1-grade reduction in bone marrow fibrosis in 26-27% of patients, around there in both the add-on and the treatment naive combo arms. So there's a lot of excitement around this drug, and furthermore, there are other correlative studies like the allele burden of mutant JAK2 going down in about 30% of patients in the treatment naive cohort. So all of this is at 24 weeks, by the way, to be clear for our listeners. All of these response rates are at 24 weeks, so a fairly early time point. And finally, last but not least, there is an Arm 4 of this study, which is in patients with ET, not MF, but ET that are hydroxyurea-resistant or intolerant. Now, those results are being presented for the first time in the public domain at ASCO and EHA this year by Francesco Passamonti. And there we are seeing about a 90% rate of hematologic response, some symptom responses, some cytokine reductions. Now, that's only 20 patients, so this is relatively early and we'll see where this goes. But for the MF, I also neglected to mention earlier, each cohort that I referred to has in excess of 80 patients. So it's a large data set in MF. And finally, the drug, as far as its registration path is being developed in combination with Ruxolitinib in the front line in a placebo-controlled trial called MANIFEST-2, which is fully accrued, and we await those results.